And that's my passion, is advocacy. And so that's really what motivated me to become a leader in medicine. When I saw that there was an opportunity for us to improve the practice of medicine, for us to relate to legislators who impact our practice of medicine, and for us to galvanize colleagues to become part of that fight, part of that initiative to actually make sure that the patients get the best care and that we have practices that are sustainable, that issue, that type of initiative was what motivated me to become involved. And one of the things that I learned early on was the fact that if you're true to your passion and you're consistent in your message, that you'll be more effective as a leader. And those were things that were kind of guideposts along the way. Another thing that is particularly important as we are in medicine, that we recognize those who are mentors for us, those who maybe are champions. They may come along at different points along our career, whether it be professionally or in an organization. And just as we have gotten benefit from them, there are a couple of women, for example, who were instrumental, very important in terms of saying, let's become part of an organization, let's have you serve on this committee, let's, advance your role in this organization. And so those individuals were invaluable because it sends two messages. One is you're important, and the other is there's someone here who is your champion, and you have someone in your corner. So important. And so I think it's also that we need to recognize that the younger physicians, the women who are just going through medical school and residency and early career, that we need to embrace them and show them the path forward. Women often need to balance the importance of having a clear, assertive voice, as well as coming across in a way that is acceptable and agreeable to others. It's a tricky balance to achieve. One can be identified as being a strong woman who actually can promote the issues of others, and that is widely appreciated when there's an issue behind which everyone feels united and that you can be a champion for them. It is very important to realize that we still do have a different standard to which we are held. And while we have the opportunity to be assertive, we also need to be cognizant of the likability factor, and so we need to balance that. And that is something where generally men do not have an issue. As a woman, barriers may have included, in retrospect, issues where perhaps the male scheduler of the department would think, oh, your spouse, you don't need to have as many shifts to work as the male members of the department. Also, in terms of leadership in different organizations, a lot of times, or even in a practice group, they might have maybe a token female member, and that is not equivalent to actually the number of graduates percentage-wise who are graduated from medical school. But people have become accustomed to thinking, oh, it's just going to be a minority party in a particular group practice. So a couple of things along those lines, and so I think people need to realize, let's look at what the reality is of the number of women who are being graduated from medical school and the fact that there's actually they're more numerous and there should be more opportunities. I would advise women to do several things. One is to find your passion and be true to that and make sure that that gets communicated to your colleagues and to others around you, and you'll have a much more clear voice when you're articulating what issue that you wish like to promote. That's one thing that's very important. Another is for you to engage with others, for you to recognize that there are others around you, and your voice can be stronger if you're part of a team, part of a group, and you can be a leader in that initiative. So if you actually amplify your voice by making sure that others know what your message is and you engage them, you actually can promote the issue that you're most interested in, and it can be a win all around.